Bible. Somebody move the board. This is what we call a standing takedown, and the reason we call it that is because people involved in a wreck, you know, been hit behind, they're on the cell phone talking, walking around, holding their neck, or whatever. All right. So, you know, you see that, you come up, grab control of C-spine. Now, even though they're conscious, standing up, I've got control of C-spine, you know, tell them put their cell phone down, you know, where you hurt at, their back hurts. Okay, you want to go to the hospital? Yes. So now, with a back injury, 10 to 15% of the people that are involved in trauma have a neurological back injury. They have back injuries, to make a long story short. We can't pick out those 10 to 15%. So one out of every 10 people that you put on a spine board is going to have some degree of neurological difficulty because of a back injury. All right. So, and administratively, instead of having C-spine down here, this person's standing up. So I grab here. All right. Now I'm gonna give control of C-spine to somebody else. So somebody come up here and take this over. Here's where we're gonna put the cervical collar on, just because I've showed you. Okay. Put your hand. I roll my hands up. He slides his hands in. You got control of C-spine? Control. Okay, good. Now, is this person stable or unstable? Is this person stable or unstable? They're standing up, right? They're talking on a cell phone. I mean, there's not a problem. Neck hurts. They won't go to the hospital, so we have to immobilize them. All right. So, with the cervical collar, there's different variations and different sizes. This is obviously the front, because the chin. The hole goes in front. All right. Not the small holes. The big hole goes in front. Why is the holes go in front? What is this for? Trachea and neck vein extension. All right. Now, the proper way to measure for a cervical collar is from the bottom of the mandible or the clavicle to the bottom of the mandible. So she's about 4 fingers. All right. So that is about 4 fingers. Right. This is just comfort. These are adjustable here. So I can adjust it to any size I like. It will adjust. All right. So that's where my measurement was. So that's where I'm going to put it. And they just lock in place. Now there's another collar. There's just one piece. This one's just adjustable. That should be, that's not adjustable.
No, this is this collar.
Okay. This is not adjustable. All right, so just be familiar with the different cervical collars. This one's going to be too big because it's going to put her head in a awkward position. So there's advantages and disadvantages to both. Okay, this one you have to really properly measure. This one the same thing. This one is obviously too big. Look. See, it's going to push her chin up. All right. So now I'm going to put the cervical collar. A couple of ways to do that. Pull your hair back a minute. Your earrings ain't too long. Yours are good. Where is my other two? We're missing somebody. Okay. Dangling earrings for females or males, all right, is a problem because where these things rest. So, put the chin in place, roll your hands up. And see how this just kind of naturally fits. Now she's got clothing and stuff on, so it's going to be a little bit awkward. But see, I didn't move her neck any one way or the other with a proper measurement. So if you have to go to court and they say, well, Ms. Weeks, how did you choose the proper size cervical collar? Well, according to the DOT, National Curriculum EMT textbook, from the clavicle to the bottom of the mandible, and then that's what you use. 4 fingers, 5 fingers, or whatever. Okay. For taller people, I have to state it out. Shorter people, that's about as short as it'll go. Put our heads in a neutral position. Does everybody agree? Okay. So now, it's going to take how many people? 4 people. But for this particular scenario, it's only going to take 3. All right. So somebody get the board. Take the head blocks. Go ahead and take those off. Just take the head blocks off. Where's Mr. Nams at? I know he knows. Chris.
Right here.
All right. Mr. Chris or Mr. anybody. Now, you are in awkward, not awkward position, but you're good. Now, remember I told you it's a standing takedown. So you're fine with the board. All right. Now, you don't have to hold it with your foot. It's gonna stand there. Your job is just to hold the neck. Don't strain. You ain't gonna have to do anything other than just hold the neck. All right. Now, if I'm facing my victim, my left arm is going under her left arm. And his right arm is going under her right arm. I reach up and grab a handhold. With my other hand, I secure her wrist. Because if I don't, and we start to fall, what is she gonna do?
Start flailing.
She's gonna start grabbing or smack me in the face or something. So I wanna control this wrist. All right, you're in control, right?
Yes.
Extend your arms completely out, just walk backwards. Extend your arms, that's the position you wanna hold right there, okay? You wanna keep her head in contact with the board, which it already is. Now, I will need to explain to my victim what we're fixing to do. Ma'am, we're fixing to roll you down on the spine board, you're gonna have a sensation of falling, but you're not. We're here from the government, we're here to help. Okay, so you want to tell them exactly what they're gonna do. It's an awkward feeling because they have no control. But I promise you, it's so simple that, you know, they're positioned on the board. Exactly. But they're apprehensive, so you want to tell them exactly what you want to do. We're fixing to lay you down, you're gonna have a sensation of falling, but we're not gonna drop you, all right? So, on your count, okay, this works real good for short people. No offense to anybody, but because you can't see what's going on and you're already closer to the ground. So, on three, just walk straight backwards and keep your hands in the same position.
1, 2, 3.
Okay, now we position her, we strap her in, and we're good to go. That's all that is. Did you feel uncomfortable? Did you feel like you're falling?
No, not
Then why was you grimacing?
Exactly. Why would you- Do what?
Because you said that.
You have to explain to them, okay, in order to do that. Okay, help you up. All right, any questions about that one? Y'all gonna be practicing all these, because these are different things that you're gonna be doing when you start using the spine board. Now, would it have been appropriate for this victim in a car wreck, walking around holding her neck, or his neck? Okay, we're gonna put the spine board on the cot, get on it, lay down. What do I gotta do? Sit and then turn. That's not appropriate. This is appropriate. Y'all use this a lot?
Yeah.
Interstate all the time.
Exactly. Exactly. Because
No.
you gotta see why.
What if they're, say, look, I'm fine, leave me alone? And they're holding their neck and they're like, ow, my neck hurts, but,
They have
well,
the
no, no,
legal
no.
right to refuse any and all
Okay.
treatment.
Exactly right.
Get them to sign that paperwork immediately.
Exactly
That's
right.
right.
Now, y'all gonna do documentation here shortly, and so how would you document that? Basically, explain the neck pain, arrived on the scene, found the patient, whatever position, explain the neck pain, walking, you know, refuse treatment. Then you document everything else there. Car was rear-ended, severe damage to the car knocked off the roadway, all the stuff that you see, document it in chronological order, so that you can come back, this patient can't come back and say, well, they didn't do nothing to me, you know, so try to get them to go to the hospital if they're holding their neck, whatever.
And they refuse to go down like that?
Do what?
Like, they don't wanna get on the,
Same thing.
they don't wanna get on a spine board?
You can pretty much talk them into doing that. I've never had one to refuse that. Now, the only time, and this is a very rare case of scenario, if they have very severe respiratory problems, whatever, it's gonna be very, very uncomfortable, and they'll tell you that. I've only had that once, a couple of times, maybe.
Okay.
No, not really.
I have had
It's
them flat
rare.
refuse to get on board.
Yeah, they'll flat refuse saying they can't breathe, you won't strap me down. When you say there's possible risk of spinal cord injury, do you understand the risks?
But not only that, but if you got someone who's extremely claustrophobic, they will not handle this well.
No, they will
And
not.
I've had patients before, they're so claustrophobic, the idea of that sent them into a panic attack. They refused.
And if they've been through it before, they know how long they're gonna be on it.
Good
They
point.
may well refuse. Good
The
point.
treatment's always worse than the injury, all right? So that's about 4 different ways on the spine board. There's a couple of others, but those are probably the most generic. Y'all have any